So identifying the need for treatment, we have to use the total serum bilirubin as a definitive test to guide phototherapy and for escalation of the care decisions, including exchange transfusion. So even though we may use TCB to monitor, to confirm the diagnosis, we have to use the TSB and to treat. The decisions to initiate phototherapy or escalate care are guided by the gestational age, the hour-specific bilirubin, and the presence of risk factors for bilirubin neurotoxicity. So all these factors will play a role in your decision making. The phototherapy charts that we get, which we'll discuss later, include these factors. The presence of hyperbilirubinemia neurotoxicity risk factors lowers the threshold for treatment with phototherapy and the level at which care should be escalated. So now it has been taken care of by giving two different charts for treatment decisions, one for babies with neurotoxicity risk factors and one for babies without neurotoxicity. So this has become clearer. It's important that clinicians use their judgment to determine the presence of neurotoxicity risk factors, including clinical instability or sepsis. So err on the side of caution is what they're trying to say. So you have to be clear. You have to look at all the risk factors. For example, acidosis as a specific risk factor has been removed, but it would be considered as a risk because of the clinical instability.